In today's video, we're going to talk about a very common condition that not many of us know what it is, and we try to either blame ourselves, or if our loved one is suffering from this, we tend to judge them, blame them, or we reassure them, or we just tell them to shut up. Don't think too much. Doesn't help our loved one, and it also affects our interpersonal relationship. It can leave us frustrated, annoyed, and we can become verbally abusive to the loved one who is suffering from this condition. Just like many other mental illnesses, we cannot see this. We have no tests to visibly see this condition, no x-rays, no MRIs, no CAT scans. This condition is only experienced by an individual who struggles with this through symptoms and through feelings and emotions and through words. And this condition is what we call as illness anxiety disorder, or also known as hypochondriasis. It just makes our life easy. It just makes the other person's life easy, gets them to seek help. If we treat this as a disorder, as a mental health condition, a disease, a sickness, then encourage him to get help and also gain tools for ourselves as to how we can support this individual or this family member or this loved one. For those of you who are new to my channel, my name is Dr. Najmun. I'm a practicing psychiatrist in the state of New Jersey. I love to raise awareness of emotional and mental health with the sole purpose to break the stigma on such. So let's dig in deep into what is this health anxiety disorder or illness anxiety disorder. Illness anxiety disorder, or as we also call it, a health anxiety disorder. So it basically involves excessive worry. I mean, not just regular worries, but excessive worries about having a serious medical condition. And even though this individual has gone to numerous doctors, numerous physicians, has done pretty much every single test, and there has been no evidence of a serious illness. It is a treatable mental health condition, so let's dig into what are some of the most common symptoms of this illness anxiety disorder. The first and foremost is excessive worry. This individual will always be talking about having this serious medical condition. They will constantly call you, either have this cancer or I have no idea what's going on. I'm probably going to die from this illness. I'm really suffering. And it's not that they have not been reassured. They have seen many doctors and all of them have reassured them there is nothing wrong with them. They have done a bunch of tests and everything is proved to be negative. Fear is almost to a point of a delusion. They do not feel reassured, maybe for a little bit, but then they will start again about their worries of having this serious condition. They're also going to avoid people, places, and activities just for the fear of this health risk. They will go and see numerous doctors for this condition. They can also obsessively search and do internet search, do Google search. It literally consumes their life. They tend to really misinterpret bodily sensations, which are just normal bodily sensation, like a little cough, a little reflux, a little cold, a little headache, a little bellyache, little constipation. It's going to substantially impair their interpersonal life. It affects their relationships with their spouses, with their intimate partners, with their children, their families, their co-workers, their friends, because they are constantly worried and constantly talking about this condition. It really does affect their work, because even at the work, it's difficult for them to focus and concentrate. And many of them can literally avoid workplaces because they're just so worried that what if something horrible happens to them. Sometimes these individuals can even avoid medical professionals just due to the fear of being finally diagnosed with a serious medical condition. A loved one may always want them to go to the doctor, and they may just say, hey, I don't want to go. And they'll just keep on talking about this health condition. And sometimes some of them will just keep going from one doctor to another doctor, spend a lot of money on it, doing unnecessary tests. They may repeat their tests. They've already done a CAT scan. After a month, they're going to go to another doctor. He's going to do a CAT scan. So it also puts a lot of financial burden on these clients, and you can just imagine the frustration that the family members feel in helping this individual. They're so emotionally distressed, and many times when family members reassure them, it does not really help them. In fact, it can make their condition worse. It's important to note that the diagnoses of this illness anxiety disorder cannot be made by a family member or by this individual who struggles with it. It has to be made only by a mental health professional. Many times they will be first evaluated in a therapist office or sometimes in a psychiatrist office, and those are the folks who will finally diagnose them with this condition. So what is the treatment of illness anxiety disorder? Now, first and foremost, I think it's important to note that if your loved one is indeed suffering from this condition, that this is going to pass, that this is treatable, and that there is really nothing wrong with your loved one. So make sure that you yourself feel reassured and you yourself take care of your anxiety before you can help this loved one. It's a chronic condition. It can really come and go depending on the level of stress, and sometimes even as a person ages, you can frequently, or more episodes can happen. But if you understand the treatment, if the person is connected with their professionals, they can go on to live a happy, healthy life. So first and foremost, with the treatment is you have to get a proper diagnosis, because many times the physicians will do unnecessary testing. So even their family doctors and physicians should be aware of this health anxiety disorder, and they should refrain from doing any unnecessary testing. Or this person can also be at a risk for missing an important diagnosis, because once they have been established as a hypochondriac, many times, it becomes like that, cry wolf situation, that they might truly be struggling with some condition. So it's really important that their doctor takes time to listen to them, talks to their family members, sees if there's any change in the diet, if there's any change in their overall symptoms. Are they sleeping more? Have they lost weight? Are they not eating? Or some other symptoms? Because at that point, it's important that you do intervene and do the testing which is necessary, and not always think that, okay, here he comes again, here he goes again, this is his hypochondriasis. And also, it's important that these folks be treated like any other person. They get their annual exam, their annual checkup, their blood work, if they're a male, get their prostate checked, get their yearly colonoscopy. If it's a female, get their mammograms, their pap smears. So whatever routine tests need to be done for somebody else, these folks also have to be subjected to those same testings. But, we get that it can be frustrating to deal with them. However, if you just spend a little time with them, show empathy and compassion, many times you can redirect them. So back to the treatment, the first and foremost treatment for this condition is psychotherapy or talk therapy or counseling. So a therapist, a talk therapist, uses various forms of therapy. The most effective one is the CBT, or cognitive behavioral therapy. The goal of the CBT becomes to break the cycle of these anxious thoughts and then the reassure-seeking behavior. Because remember, in this condition, a person has these negative thoughts, this constant need to feel reassured. It's more so kind of like an OCD-like picture. So in order to help them, we have to break this cycle. How do we break it? We first of all teach them how to identify these negative thoughts, that, okay, I'm having this thought that I felt a little body sensation, maybe a little headache, maybe a little cough, and then they're taught to first identify it. Okay, the thought is there. Second, they're taught to challenge this thought, that every cough is not a lung cancer, every sneeze is not a lung cancer, every stomachache is not a stomach cancer. So they're taught to challenge these thoughts, and then gently they can replace this thought with a little more positive thoughts, which is like, okay, I had a little bit of cough. I'm going to go take this medicine. I'm going to go see this doctor. And just like 2 months ago, I had this bout of cough or a bout of cold. It got better. So hopefully this time as well, I will get better. So that's called the CBT. Second is the exposure therapy. Say, for example, this person, he's worried about his stomach cancer, right? So we're going to go do an endoscopy, then a doctor will sit with them, read a report, kind of show them the images and then answer their questions and just kind of teach them that, hey, this is what we saw and stuff like that. Mindfulness-based therapies are also very helpful. We teach these individuals how to be mindful and paying attention to the nature, or going for walks, or just reading a book, or playing with their children. Deep breathing and whole body relaxation, extremely helpful. We all know that deep breathing, body relaxation helps with any kind of anxiety, but it also helps a lot with this health anxiety. So we teach them how to do either box breathing, taking long, deep breaths with pauses in between, that whenever they feel a small body sensation, their body or their amygdalas all get activated, and they immediately think that, oh my gosh, this is the end of the world, this means cancer. But as soon as they do the deep breathing or whole body relaxation, their body relaxes and their heart rate goes down, their blood pressure goes down, and that panic button also learns to just calm down, and their more mature part of the brain takes effect and uses the proper judgment, and then they engage in the self-talk where they go, all right, it doesn't mean this is cancer. I'm going to be okay. Things like exercise, joining a gym, doing yoga, walking, all of these things are extremely beneficial. Then medications. Medications also have a role. I have had some clients who struggle with hypochondriasis who refuse to take medication. So through some self-help strategies, holistic ways, therapy, they're able to manage their condition. But a lot of them who are very busy, have busy lives, have busy families, are moms taking care of little kids, dads having to go to work. Now for them, sometimes medications is very important to maintain that functioning. The same sort of medicines that we use for anxiety, the SSRIs or serotonin reuptake inhibitors like Prozac, or like fluoxetine, sertraline, escitalopram, paroxetine, or we also use what's called SNRIs, serotonin norepinephrine reuptake inhibitors, drugs like Effexor or venlafaxine, desvenlafaxine, duloxetine. So those sorts of medications are used. We do try to avoid using benzodiazepines because it gives them immediate relief, and also because it's a chronic condition, so the risk of tolerance and dependence to the benzos can be heightened. They're sedating. They can also hamper their recovery, because see, we want these individuals to learn how to handle their anxiety. We don't want them to shut their anxiety, block that anxiety, and then basically they don't see a need to use those coping skills. So we have had clients who started with being hypochondriac or with health illness anxiety, and unfortunately they got immediate relief from using benzos, and then their providers, because remember, they can be frustrating because they keep on coming to you. So providers get very frustrated, and then they just give them a script for a benzo, say, just go take it 3 or 4 times a day. But over a period of time, they don't learn how to handle their anxieties. The moment any bodily sensation comes, their anxious mind starts working. So instead of using those healthy coping skills, instead of challenging their thoughts, they will go ahead and take that alprazolam or Klonopin, and that will immediately give them relief. But that relief lasts for 4 to 5 hours. After that, their anxiety kicks in again. They go and take another benzo. So all of that can put them at a risk of tolerance, dependence, and some of these clients, unfortunately, also can not just become physically or psychologically dependent on these sedatives, but they can also then start developing an unhealthy relationship to these benzos and lead to substance use disorder. If they run out of a prescription, they can go and get them from illegal ways. They can even use some other medicine to give themselves that immediate relief, because they have never used their coping skills. They have never learned how to manage that anxiety. That's why it's important to be very careful. But sometimes if, the health anxiety is so bad that if it affects their functioning, it affects their appetite, their eating, then in that case, a short-term use of benzo is essential up until the SSRI kicks in, or up until they learn methods to manage this anxiety through psychotherapy. There are some non-benzodiazepine short-term anxiety relief medications like buspirone or hydroxyzine, which is an anti-allergic medicine, propranolol sometimes, which these folks will, we just tell them to carry it with their purse, and if their anxiety becomes overwhelming, then to resort to those sedating medications or non-dependent medications, they usually do not cause tolerance, so it is okay to use that. When you have an acute phase of health, illness, anxiety because of some stress or a change or a death of a loved one, at that time sleep gets really affected, and that can affect your overall functioning. So sometimes short-term sleeping aid is recommended. For example, trazodone, melatonin, hydroxyzine, Benadryl in very rare cases, but we can use this. But for everything, all of this, just talk to your provider, talk to your family physician or a psychiatrist who can help you find that right regimen if you are going or wanting to go that route of medicine as, again, not a cure for health, illness, anxiety, but just as a method to manage it, at least in those initial phases. Psychoeducation means to stay informed, to stay educated about what is health anxiety disorder, and that it is a true medical condition, a true psychiatric condition. It doesn't mean you're faking the symptoms, which happens a lot with these clients because their families are so fed up with them. There is no test that proves that they have a condition, so they become victims to this judgment, and sometimes, they feel that they're faking their illness, but they're truly under distress because it's a true anxiety. It's a mental health condition. So that's why educating themselves about not the medical condition that they're afraid that they have, but educating themselves, because once they have this proper diagnosis, then to stay informed and educated about what is a health anxiety disorder, how I can manage it, how I can manage my anxiety, how I can manage my stress. That becomes crucial if they're aware that a new stress has come, maybe a death of a spouse, a death of a parent, a child got diagnosed with a new condition, some change in your daily routine, which will then put you at a risk of anxiety. So to anticipate that thing that, okay, right now my stress level is high, right now my anxiety is high, I'm going through this change. And then if you notice these symptoms coming again, if you notice this worry about, do I have a serious medical condition, remind yourself that, okay, could it be that I'm having another bout of this health, illness, anxiety? Still go to your primary care doctor, get that reassurance, do whatever testing you have to do, and if everything proves that to be negative, so again, resort to therapy, to deep breathing, whole body relaxation, mindfulness, creativity, whatever other ways you are able to manage that. So that's why it's important to stay connected with your therapist, because there may be some times that you may need more sessions, and once you feel better, you feel improved, then your frequency of the sessions will go down, and for that your therapist is going to guide you. It's not just the clients that have to stay educated and informed, but the family members also have to be educated and informed about this condition, so that if their loved one suffers from it, instead of judging them, thinking that they're faking these symptoms, or like, here you go again, and becoming verbally abusive to them, yelling at them, which is a risk to this condition, because you're also a human being. When your family member keeps talking to you about, oh my gosh, I'm going to die, I have this cancer, it will annoy you. So to take a little break and say, I get it, you're feeling anxious, you're feeling worried, I get it, I will talk to you later about this, or just asking them questions is actually very helpful. There is a technique in our field which is called motivational interviewing. So motivational interviewing is basically demotivating a person by just asking them right questions, open-ended questions, which sort of helps them also to clarify things in their mind. So you can always ask them, so what's going on? What's going on in your life? What are you thinking? What do you think is going on? Did you see your doctor? What did the doctor say? Have you done some testing? What did the testing reveal? And stuff like that. Or how can I support you? And just say, well, this thing happened last year too, John, when you were going through a divorce and you quit your job, or when you were laid off from a job. I remember that time also you were so worried about having cancer, and all the testing were negative. So I'm just wondering, are you going through some stressful situation right now? Or could it be possible that you're going through another episode of illness, anxiety disorder? You know what? Would you like me to call your therapist, or did you call your therapist? Should we go to see our psychiatrist? Maybe we need a medication change. Have you been taking care of yourself? Showing empathy, showing compassion, but at the same time, setting that boundary and not going in this unhealthy cycle of reassuring them constantly, because that is not helping, and it's also going to tire you. It's going to affect your relationship. This is a very close loved one. Sometimes getting therapy yourself will also save you that sanity, because remember, anxiety is highly contagious. If there is one family member struggling with anxiety, the children feel anxious, the spouse feels anxious. It's important to take care of yourself and also get support through your own therapist. Children get very confused if one of their parent is suffering from health anxiety, and I don't know if you've noticed that if any of your family member had health anxiety, the moment mom and dad go through that active episode, you will notice that children will model this behavior, and someday you may get a call from your child's teacher or child's nurse saying that, hey, Amy is complaining of a stomach ache, and that might become repetitive, and that may be through modeling, and there's also a genetic correlation. So family therapy, or even getting a therapist for your child, is extremely important. It's just going to help to ease out the tension in the family and also help improve your relationship. It's also important for such individuals to have a collaborative care. It means a family doctor and a psychiatrist or a therapist should at least be talking to each other once or twice, just to make sure that every end is met. A psychiatrist who treats this individual, it is important that he asks him to check the lab work, to check the other test, or also gives a call to the primary care and say, hey, what's going on? What have you tried? So that there's not a repetition of medications, because many times what we notice in our practices is that the family doctor has already tried so many different antidepressants, then they come to the psychiatrist, and some psychiatrists will go back and try more antidepressants, and sometimes a psychiatrist is against prescribing benzodiazepines for them, but a family physician is so frustrated with them because he keeps on coming to their clinics, and he keeps on asking for these unnecessary tests, that many times a family physician will just hand them a prescription for a Xanax, Ativan, Klonopin, all these sedatives, and then what happens is that this individual shows tolerance, becomes dependent. Family doctor catches himself in this unhealthy cycle where he finds that, oh my gosh, I've become a supplier of drugs for him. They'll get frustrated and they refer them to a psychiatrist. But by then, this health illness anxiety has basically become more like a substance abuse disorder. It has become like a sedative use disorder, a benzodiazepine use disorder. And sometimes this can also create a lot of tension between the treatment teams, like the treating physicians, disagreements between a psychiatrist and a family doctor, and then the treatment team is kind of split, and that doesn't help a patient and also causes unnecessary stress in a practice. That's why staying educated and informed, both as a patient, as a family, and as a provider or as a nurse, is extremely important. And getting this person that collaborative care is extremely important. Getting him to a right therapist is extremely important. Educating him about the difference between a real medical condition and a psychiatric emotional condition is important. And also showing empathy and compassion for this individual is very important. And lastly, for such individuals, learning to manage their stress is crucial, and that could be the same thing through exercise, through healthy eating, making sure they're hydrated, have water, they know their stress management techniques, meaning maybe attending a yoga class, maybe attending a retreat, walking, something called forest bathing, like spending time in nature. That is so soothing for your brain, for your body. So they can always go either on a hike with their child, with their wife, with their spouse. That is very soothing for them. Taking frequent breaks, taking some time off, going on a vacation, basically managing their stress will help them to keep their health anxiety disorder in check. Making those healthy social connections is also very important, because when they develop an acute episode of health anxiety disorder, these folks, they're aware, because they're intelligent, they're aware that, my worries are affecting other people. So they will try, not to go to a gathering, and they will isolate, and that isolation further worsens their illness anxiety and can lead to depression in severe cases. So it's important that they seek those healthy social connections to people who are non-judgmental and can provide that listening and empathetic ear. Just to summarize it up, health anxiety disorder or illness anxiety disorder, also called hypochondriasis, is a true psychiatric condition. No, a client does not fake it. They don't verbalize these symptoms just because they're attention seeking. It's a real psychiatric condition, and it's a treatable condition. There is help, there is treatment. Just educate yourself about it, get the right help, visit a therapist, and in severe cases, see a psychiatrist. The average duration of an episode could last from anywhere from 6 to 8 months. If untreated, however, with proper treatment, you can really shorten the course and lead a happy, healthy life. Don't forget to subscribe to my channel to receive more videos on your emotional and mental well-being. Take care. So long.